Okay?
Here.
Oops, nope. Put your alcohol wipe down. Sorry. What is the very first thing they did in the video? I messed up. Take off the caps and put them to the side.
First.
Don't put them in the trash can. Put them to the side. Okay. So I took off the caps and I put them back. Put those back. Now my caps are over. Remember, the trash goes where? Off to the side, right?
Mm-hmm.
We don't go in and out of the hood multiple times. We don't want it. Why don't we do this in and out multiple times to throw things away?
You're getting in the left.
Yeah, it's turbulent airflow. All right. So now we're going to open our unopened alcohol pad that's unopened, and we're going to pull out the alcohol wipe. We're going to wipe the top of the 2 vials and the injection port of the bag. Okay. All right. Now, put your trash over to the side. Now, we're going to open our syringe into the airflow. So open your syringe. See how I'm doing this? The airflow is coming towards me. I'm going to open the syringe into the airflow and pull the paper back. Okay? This is Peacock's way. You can do it your way as long as you don't contaminate anything, but I'm just going to show you my way. Okay? All right, so then you're going to pull this out, put your trash over to the side, and this is a critical area, right? This has to remain sterile. Keep it in the airflow. So what I do is I place it in my non-dominant hand between my peace sign fingers. Then, okay, so non-dominant hand, peace sign fingers. Okay, and you don't have to hold it up high. You can if that helps you when you're in the hood to hold it eye level, but you don't have to as long as you keep it in the airflow. Then I take my dominant hand, grab my needle, and I've got my other fingers. See how this works? I've got my other fingers to open my needle, but this is still into the airflow. Okay, so I'm going to open my needle, pull the paper back.
Kind of like what you said. Mm-hmm.
Everybody good with that? See what I'm doing? Okay, then you're going to, you can change your grip if you want, but you're going to lure lock. That means it screws on. Okay, still have my paper in my hand. Now here's what you don't want to do. Okay, I'm going to show you a don't. Okay, what you don't want to do is do anything with this out of the airflow, because this is also a critical area, right? This yellow part, critical area. So now I've screwed this on lure lock. Okay, now I'm going to put my paper down. Oops, I'm not going to throw it around the hood. Okay, all right, so now you have your syringe with your needle on it, right? Take it in, I take it in my non-dominant hand, this way out in front of me, and I pull my hands away from each other. And I'll tell you why I do that. Because if you don't do that, if you're trying to do it like right here, you're more likely to stab yourself, because there's a little reflex that occurs.
And that's
This
a biopsy,
all sounds crazy,
so we don't want to take a
but I'm
biopsy.
actually telling you things that have actually happened in this lab over the years. I've learned every year one more thing I need to say.
I can send you this one.
Because the idea in this lab is not to stab yourself or anyone else. All right, so put your cap down. And actually leave your cap in the airflow. So open cap in the airflow. Good job, John. All right, so the open part of the cap is in the airflow, in case you have to recap for some reason. Okay, you're usually only going to recap if you're going to throw away the needle, so you don't really have to keep it in the airflow, but I usually do. All right, now I am going to pull up 2.5 mils of air. And I am going to do that without, the only place I'm going to touch on this, I'm going to touch the outside of this barrel, and I'm going to touch this little disc part. And I'm going to use my pointer finger to pull back. See how I'm doing? See this? Like this. You can also use your fingers like this. I find it's more stable if I do this, because then I can go back and forth. So you're going to pull back to 4 halfway in between the 2 marks is 2.5. And that's as little as you can estimate. Like you can't estimate a fourth of the way between those marks, right? So we only need to go halfway, and that's 2.5. Are we good? Are we good? Yeah. All right. Now, Notice I'm not putting my hand behind this barrel. I'm not touching this, and I'm not putting my hand behind this. I'm not putting my hand behind this. Critical area, critical area, critical area.
Don't touch that.
Okay? Because if you block the flow to this and then you're going back and forth trying to get air out, you're potentially pushing things from this into the syringe. Okay? So it's just good practice not to do that. All right, so I've got my 2.5 mils of air. Now, I'm going to take this in my dominant hand. I'm going to pull the diluent bottle closer to me, and I leave it on the bench top at first. You're going to take it in your dominant hand like a dart. Okay, I'm not going to throw this, don't worry. Okay, and the bevel is up. The reason the bevel is up is because this is a technique that prevents coring. Okay? So you take your needle, bevel up, down. So I've got it at a 45-degree angle here. See? But I do it on the bench top to stabilize myself. But it's about a 45-degree angle, and then you straighten up as you go in. That prevents coring of the stopper. Because what you could do is get a little tiny piece of rubber, if you don't go in like that, that comes out and either goes into the liquid or gets stuck in the needle. Okay? So now I've got this in here. So now, this is where I'm going to do the fancy handheld thing, okay? So now you're going to sit it on the bench top. You're going to take your peace sign fingers of your non-dominant hand, and you're going to put them on the vial like this. See, peace sign fingers on the vial? Then you're going to grab the syringe with the other fingers and flip it. So you're holding it like this. But hold it far enough, get a big angle. So hold it. Your fingers are spread as far as they'll go. You don't want these fingers up here on the in the critical area. Okay? So do them as far as they'll go. Then you're going to exchange the air for water. Why do I have to put air into this vial? Because it's a closed system. If I just try to pull a bunch of stuff out, I might get away with a little bit, but I'm not going to get away with a lot. So you're just going to go in and out, exchanging the air for water. Okay? And I would draw up more than you need at first. Okay? All right? So then I'm going to, I forgot what I said this about earlier in the semester, but you're going to knock the hell out of it. And you're going to knock the bubbles up to the top. Now, I don't really care if there's air in this syringe because there's air in my mini bag. But if there's air in the syringe, what am I not measuring? Oh my God. Drug, right? Or diluent, right? So it's not accurate. So whack them up to the top, but then is that good enough? What do I have to do?
Measure it out.
Push them out, right? Push the bubbles out. Go past 2.5. Go way up in there. Push the bubbles out. You hold it either like this,
I have little bubbles.
or if you're not holding it.
Yeah, those are so annoying.
This can't go behind there. And you can't grab this part.
You just keep pushing back into this.
Hold this.
Yes, finally. Next bubble.
Okay, it's easier if you hold this straight up and down. If you're not going to do a one-handed hold, okay? If you're not going to do this kind of hold, you've got to actually have these fingers out of the way. They can be up like that. They can be tucked back. But I always like to joke with students, if they do this, I'm going to cut them off. Just kidding. All right. So do not block the airflow to the plunger or this. These are critical areas. All right. So I've got my water. All right. So now you're going to, once you get all your air out, you're going to whack it up to the top and then push it out and then pull back. Just as long as the needle tip is in the liquid, all you're going to pull back is liquid. So pull back enough liquid that you're at 2.5, and then you're going to sit your vial down, okay, and take this out. Okay? Now, push that vial to the side. Take your powder vial. We're going to hold it like a dart again, not in your dominant hand dart. You're going to go at a 45-degree angle, and then you're going to go straight in, okay? And And then you can just leave it down, and you're gonna exchange water for air. I don't want a positive pressure in my vial because if I have a positive pressure, when I enter it again, it's gonna spew, okay? All right, so I exchanged a little bit water for air, and then now I have just air in here and water in here, okay? Yes?
This is into the one that starts with the training vial?
Yeah.
Yes. Does it have a powder?
Always push back on the
Yes.
valve.
Okay, so
I
now,
understand
you have two
Maybe
options.
They kept pushing
Okay,
it down.
you can leave this in there if you want and dissolve it, or you can take it out. Okay, you can take it out and dissolve it. Some things really foam if you shake them too hard, so some things you have to just swirl. And then some places have, I don't know if you've worked in a hospital, but some hospitals have these things that look like those hot dog rollers from the 7-Eleven, and they roll vials back and forth like this. So they actually, if something's hard to reconstitute, bless you, they might, I've done all of this 6 inches into my hood, right? I'm still all in the airflow. Now, if you think that you have compromised the top of this vial by shaking it around or doing something, you can actually grab your alcohol wipe or another alcohol wipe and wipe it again if you think you've compromised it. Okay? Now the next thing I'm going to do, I just left my air in the syringe. Okay? So the next thing I'm going to do is go back into this vial, and I would pick a different hole. Because if you go back into the same hole, you're likely to make a big hole in the vial and it's likely to leak. Okay? So go at a 45-degree angle and then straight in, okay? And then do your flip up technique. And you want to get the vial so that the hole in the needle is in the liquid. If the hole is in the air, you're going to draw up air. Okay? So then I'm going to just start exchanging my air for liquid. Okay? And when you get down to the bottom, it's sometimes easier to switch your hold to the two-handed hold like this, because you can bring this down and see there's a little cup in the vial. You actually bring the tip of the needle down into the cup like this, and you can get all of the liquid out. Okay? So if you bring the needle, tip of the needle, there's a little practice that comes, but then you can get all of the liquid out. Okay? Everybody good?
Yes.
And you don't have to get the air out because we're drawing up everything in the vial. If you were measuring a volume, okay, hey guys, if you were doing KCl, it's already a liquid, and drawing that up, you would need to get the air out because you're measuring the volume. With here, you want to get the majority of the air out, but you don't have to get all of the air bubbles out. Because I want you to draw up everything in the vial. Okay, anybody need help with that? And sometimes it's helpful to pull it down so you can see if you got everything out of the vial. All right, are we all up to this point? Once you have everything out of the vial, pull a tiny bit of air so that you don't spray this out the needle when you take it out. Then you're going to sit this down. You're going to pull the needle out. You're going to hold the bag port close to the bag, not on the side of the port. Why? What happened to me when I made a morphine bag and I held it on the side of the port? It got blood everywhere in the hood because I poked my finger. Okay? So you're going to hold it on the side. Now the stopper, the bag, you can go straight in. You do not have to go at an angle. So the bag, you go straight in. It's a little harder. And then you just inject this into the bag completely. You don't have to get the air out. You don't have to, once you draw all your liquid into the syringe, you're done unless you have a lot of air. Leave your bag on the hood facing the airflow, and you're going to inject straight into the port, but don't hold the port on the sides, hold it near the bag. Inject straight in. Once you inject, take your needle out, and where do you put your needle with the syringe?
Sharps.
Into the sharps container, right now. So carefully put them into the sharps container. Huh? Do not recap. In the real world, you do not recap unless you have to change the needle.
And the rest of it goes in the regular trash, right? The rest of our...
Yeah, okay, so wait a minute, we're not finished, but yes. Okay, so now I'm gonna mix my bag. Okay, so now I'm mixing. The other thing I'm gonna do is turn it upside down and squeeze it a little to make sure I didn't make a hole anywhere in the port. Okay, so squeeze a little, so we're mixing, and then we also look at the back, and normally it's not this, it doesn't have this blue thing, but you're gonna check and make sure there's no precipitation or things floating in it, okay?
Nothing.
And
floating.
then you're going to put, there's like a little seal that you put over the tip of the bag that shows you've injected. You're gonna label it, and you're gonna send it to be administered. So how are we feeling? Are we feeling a little better?
Yeah.